Good morning, everyone. Today, we're going to delve into the pathology of emphysema, a chronic and debilitating lung condition. Understanding what happens at the cellular level is crucial for grasping the impact of this disease. Let's start with a healthy lung. Think of your lungs as an intricate tree. The trachea is the trunk, leading to the bronchi, which are like the major branches. These bronchi further divide into smaller and smaller airways called bronchioles. And at the very tips of these bronchioles, we find the alveoli. The alveoli are the functional units of the lung, the real workhorses. Imagine them as tiny, thin-walled air sacs clustered like bunches of grapes. Surrounding each alveolus is a network of capillaries, tiny blood vessels. This is where the magic of gas exchange happens. Oxygen from the air we inhale diffuses across the alveolar walls into the bloodstream, while carbon dioxide, a waste product, moves from the blood into the alveoli to be exhaled. Now let's look at emphysema. The core problem is damage to the walls of these delicate alveoli. This damage leads to a loss of elasticity, a key characteristic of healthy lung tissue. Several factors can cause this destruction. The primary culprit, by far, is smoking. Cigarette smoke is a cocktail of harmful substances that irritate and inflame the lung tissue, triggering a cascade of events that ultimately destroy the alveolar walls. Another cause, though much less common, is a genetic condition called alpha-1 antitrypsin deficiency. Individuals with this deficiency don't produce enough of a protective protein that safeguards the lungs. Finally, prolonged exposure to environmental irritants like air pollution, dust, and fumes can also contribute to the development of emphysema. So what actually happens in emphysema? The damage to the alveolar walls leads to a progressive loss of elasticity. The alveoli lose their ability to expand and contract effectively. This in turn causes air trapping. The damaged alveoli can't efficiently expel air, so it gets trapped in the lungs. And critically, the destruction of alveolar walls reduces the overall surface area available for gas exchange. This means less oxygen can get into the bloodstream. The consequences of these changes are significant. The most prominent symptom is a shortness of breath, as the lungs struggle to deliver adequate oxygen to the body. Patients may also experience wheezing, a whistling sound during breathing, and a sensation of chest tightness. A persistent cough, sometimes with mucus production, is also common. And unsurprisingly, the reduced oxygen levels can lead to profound fatigue. It's important to understand that emphysema is a major component of a broader disease called chronic obstructive pulmonary disease, or COPD. COPD encompasses a group of lung diseases that obstruct airflow, making breathing difficult. The other major player in COPD is chronic bronchitis, which involves inflammation of the bronchial tubes. Many individuals with COPD actually have both emphysema and chronic bronchitis. Let's recap. Emphysema is characterized by the destruction of alveolar walls, leading to loss of elasticity, air trapping, and reduced gas exchange. Smoking is the primary cause, though genetic factors and environmental irritants can also play a role. The result is significant breathing difficulties and a range of related symptoms. In the context of COPD, understanding the specific pathology of emphysema is crucial for diagnosis and management. Now, do you have any questions about emphysema?